Next, Mr. Jowhari, please, for 5 minutes.
Thank you, Mr. Chair, and first of all, thank you to both ministers and your officials for coming on such short notice. And I understand this is a bill that's not important. It's important, not only important to the government, but important to Canadians. So I just wanted to acknowledge that and thank you. I'm going to start with Minister Duclos. Minister Duclos, at the outset, there was a lot of discussion around consultation with the provinces and territories. You were very clear on responding to that. Some of my colleagues later on asked about the level of consultation that were done with the expert, and you said you're in a position to be able to share that. So, sir, can you share with us who did you talk to and what was the scope of it, and probably shed some further light into that breakdown that was the topic of discussion a few minutes ago. Thank you, sir.
Thank you, and you'll stop me when I have exhausted my time. So the Canadian Dental Association, the Manitoba Dental Association, the Ontario Dental Association, New Brunswick, Yukon, Nova Scotia Dental Association of PEI, and then I'll skip a couple of others. The Canadian Dental Hygienists Association, l'Association des chirurgiens dentistes du Québec, l'Association des facultés de dentisterie du Canada, l'Association canadienne de dentisterie de la santé publique, l'Association canadienne des assistants dentaires, l'Association canadienne des thérapeutes dentaires, the Denturists Association of Canada, the Canadian Academy of Pediatric Dentistry, the Canadian Association of Emergency Physicians, a Coalition for Dental Care, the Canadian Society for Disability and Oral Health, the Society of Rural Physicians of Canada, Children's Healthcare Canada, HelpAge Canada, and I have about 20 more that I could list also.
Thank you, Minister. That really gave me a sense of not only you reached out to the oral healthcare professionals, but also to the pediatrics doctors to be able to kind of have a whole of an approach. And now it makes me a lot more comfortable understanding where the rates or the benefit around 650 came. Was there a logic into saying, hey, look, 650 is equivalent to one annual checkup, one annual, cleaning, and one annual. Is there anything that you or your official could shed light on that?
That's a wonderful question, and it's indeed what we did. When I say we, it's all of these experts and very engaged stakeholders that care very much about the dental health of our children. They looked at what, as you said, a basket of preventive, diagnostic, and curative services would be, looking at over a significant amount of time. So what's right for them to have as we said in French earlier, to have to reduce their risk of ending up in a bad oral health condition, which, as I said, can lead to severe cases of generalized infections and diabetes and many other diseases which have an impact on their long-term health conditions. So having constructed that basket, they estimated the average cost of that particular basket, and then they ended up with that figure, about $650, which in some cases might be above what they would need in a particular year, but that's fine because the cost of living for families with such young children is very significant, and we know they'll be using these resources for the better and the best health care services possible for their children.
Thank you, Minister. Minister, this package is called Canada Dental Benefit, and we understand it's over 2 years, but this is our initial work toward what we call the National Dental Care Program. Can you explain how the work that we are doing now would strongly position us in be able to not only develop but roll out the longer-term national dental care program?
Well, thank you, MP Jowhari, for